Hi everyone, this is Sean. Welcome back to my channel. In today's video, I am going to be discussing a real life event that I observed. This event encompasses the entire behavioral health challenges that we have in California. If you are a private security officer, you work in a hospital, please listen to this content to its entirety. If you work private security and you have people who have behavioral health challenges that enter your facility or enter your property, please listen to this. This is almost a cry for help. Right now, I work for an agency, and I'm not going to discuss what agency I work for, whether it's a private employer or a public employer. But I'll tell you this. My employer policy is basically I can't disclose specific information to the public. Now, if the issue is a matter of public concern, then I have a First Amendment right to disclose a little bit more information than usual, and that's what I'm going to do today. There's a grave public concern right now. Please listen to this message here. There were some police officers that brought in a patient. This person suffers from PTSD from the military. This person served in combat. This person has a challenge right now, overcoming his anger. These officers brought in this person on a 5150 hold. If you are not in California, or you don't know what a 5150 is, 5150 is the Welfare and Institution Code that allows police officers, law enforcement officers, to place somebody into protective custody, to temporarily detain that person and transport that person to a behavioral health facility, a facility that's better equipped to, or best equipped to address this person's behavioral health challenges. That's what a 5150 is. And normally it's a 48-hour hold. Now, a person can see a psychiatrist within the first hour or the second hour, but the limit is 48 hours. After that 48-hour mark, that facility has to have some good reason, some good cause of holding that person longer than 48 hours. Anyhow, these officers brought this person under a 5150 hold. In that jurisdiction, the behavioral health agency most of the time requires a medical clearance. Those of you who work hospital security, you've probably seen law enforcement officers visit your hospital facility for these medical clearances. The officers wait about 4 hours, maybe 5 hours. And at one point in time, this patient says, I am not going to submit to any blood test. I'm not. Those of you who work in hospitals, patients sometimes get paranoid. They believe that there's something in the needle. They believe that test is going to be sent somewhere else. Different doctors, different nurse practitioners, physician assistants, nurses, they try to persuade this guy into giving a blood sample. The behavioral health facility will not accept any 5150 unless they submit to a blood panel. They want to see what is in this person's blood before they accept this person. I communicated to the facility, the behavioral health facility that was supposed to accept this patient, hey, this person has been cleared medically. I have a medical clearance. However, this person does not want to submit to a blood test. This person said, unfortunately, officers, and if I give you this information that it kind of sounds like third person, first person, second person, I'm blending them in, forgive me. This is the best way that I can explain this situation without getting myself into trouble, without disclosing too much information. I'm sure you guys understand. The supervisor that's in charge of this behavioral health unit said, unfortunately, officers, we are still going to refuse to accept custody of this patient. It's imperative that we receive the blood results. We have COVID-19 that is flourishing in the behavioral health unit. We want to make sure this person is as healthy as possible, that there's no underlying medical conditions. I get that. This person refused custody of this person. So I asked this person, if you were the police officers in charge of this person, what would you do? And this person said, talk to the hospital. They can hold them for longer. This problem that I'm experiencing, that law enforcement officers are experiencing in California and other states, this is not something rare. I myself, I've been to behavioral health workshops for training purposes, and we have law enforcement officers, behavioral health specialists that are in this training event. We have directors of mental health, and I was the only one that spoke out to the director of behavioral health. I said, sir, with all due respect, this behavioral health department that you have in this county is one of the most worthless behavioral health departments in California. I've worked in other cities, other counties, and they are not as incompetent as you guys. The whole room was silent. The behavioral health director, not the director, but all of the managers and supervisors started trying to find out, they started to give out some type of excuses. The psychiatrist who was in charge of the training said, hold on for a minute. This officer has a good point. What is going on in your county? The director didn't know that a lot of times the behavioral health unit were refusing custody of 5150 patients. They didn't know that. Or they send the officers to the hospital to wait with this patient for an indefinite amount of time because there were no beds available. The director was furious because, well, number one, he was confronted in a whole classroom, and I confronted him. About a couple weeks after that, the law enforcement agencies in that area in that county, didn't have much of a problem. They would accept almost every behavioral health patient. Now in this county, we're going back to that. So what happens if a behavioral health facility does not accept a prisoner, not a prisoner, I'm sorry guys, they're not prisoners, a patient that's medically clear? What happens? Okay? The officer is forced to just leave this patient at the hospital. They talk to the charge nurse, we are no longer in custody of this patient. You guys who work in emergency rooms, you work security, you already know what happens. Just think out loud to yourself. What's going to happen next? When law enforcement leaves, what is going to happen? That's right. AMA gets medical advice, or the patient just walks out. Patient walks out. We do ourselves a disservice when we do this to our veterans. This behavioral health facility is they're so lucky, you guys, that there are some HIPAA regulations. And fortunately, HIPAA is not always relevant to third parties like law enforcement agencies, but there are privacy rights. Fortunately, this person, they're just fortunate that I don't go out there, or some other police officer doesn't go out there in public and mentions what they did or what they did not do to a veteran. They didn't accept custody of this person who was a danger to himself and a danger to other people. What happens is this person is released into the community, and you, as private security officers, you have to engage with these people who are not accepted at these behavioral health clinics, behavioral health facilities. One of our subscribers, I'm not going to mention his name. I'm not going to mention if he has a channel or if it's a she. I'm just going to mention the word he. If I disclose who this person is going to get fired from their security job. So what I do is, when I receive the videos from this person, I just delete them. A couple days later, press the delete button. And I am appalled. I am frustrated in what I see. This person sends me these videos, and I fear for this subscriber safety, you guys. This person has to deal with these people who are dangerous, who law enforcement has tried to deal with, and they can't deal with them anymore. They can't. Guys, I seen this person, this subscriber, has sent me a video of this person throwing a punch at one of his partners, almost hitting him. This person doesn't get prosecuted because this person is a patient, a behavioral health patient. We don't prosecute behavioral health patients because how can they articulate a criminal intent if they have a behavioral health challenge or a behavioral health diagnosis? So they get away with a free punch, a free hit. Those of you who work hospital private security, you should get a raise. You should get a raise. It's getting dangerous in California. It's getting ridiculous. As soon as COVID hit, the behavioral health agencies in this jurisdiction refused to accept a lot of people, you guys, who are extremely dangerous to themselves and others. Unbelievable. This particular behavioral health agency gets millions and millions of dollars from federal aid. Yet they can only house, and I'm told, seven patients. If a juvenile is brought into this facility, then that's going to decrease the number of beds that they're able to accept. They're having problems recruiting people. So there's something in the behavioral health industry called a sitter. If a law enforcement officer cannot wait forever in these medical facilities, they often get what's called a sitter. This behavioral health agency used to send 2 sitters until this person is medically cleared. Once they're medically cleared, they bring this person in a caged vehicle, in a caged behavioral health unit. These are non-sworn mental health workers who are highly trained to de-escalate situations. They bring them to this behavioral health facility. Sometimes they bring them to other counties in this caged vehicle. They can't find enough people that want that assignment right now. They have a manpower shortage. You know what really pisses me off right now? The governor of California on Labor Day signed a bill that mandates fast food workers, as long as they are employed by a chain that has over 100 restaurants, mandate a $22 an hour wage. These mental health workers in my county only get about $18 to $19 an hour. I have totally nothing against fast food workers. We need them. They do a wonderful job. They work harder than I. Obviously, the challenges that they have to overcome are a lot different than what you have to overcome and what I have to overcome every single day. But I do believe that they physically work harder than me, and they physically work harder than a lot of other people. But why is the mandatory wage at $22 an hour? We can't even get enough behavioral health employees out here in my county.